If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then online oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Hello everybody, this is Dr. Riaz with another episode of Be Smart, Fight Strong. This is a series of videos that I'm doing. Please make sure that you check out my other videos and visit my website, and also subscribe to my channel on YouTube. Today I'm discussing a very important topic. What are the common side effects of the chemotherapy? I would also like to check out my other video in which I'm talking about what you can do about all those side effects of the chemotherapy. So let's dive into today's topic. We can divide the side effects of the chemotherapy into short-term and long-term. The short-term side effects are usually temporary, and they are short-term, and after a few days to a week, couple of weeks tops, they go away. But the long-term side effects can stay indefinitely for the rest of your life. So let's go over the short-term side effects first. What I would like you to do is that imagine or picture your whole body, and we will start from the top and go down. Now, at the top of our body is the brain. And when people are getting chemotherapies, they experience a decline in their cognitive function. The thought process can slow down, the ability to process the information, the speed at which you process the information can slow down. And this can be the effect of the chemo, this can be effect of the other medicines you are getting with the chemo, which are not chemo themselves, but they are part of the whole chemo program, and those could be the pre-medications you are getting to prevent reactions of the chemo, like Benadryl is a common medicine. Sometimes people are on pain medicines. So all of these factors can slow down the speed at which the brain processes all the information. Other term they use for this kind of phenomena can be chemo brain or brain fog, because everything seems little cloudy. Then coming down is the mouth, and sometimes chemotherapy can cause sores in the mouth. It can give a raw, rough feeling in the mouth. Depending upon which chemo you are talking, these side effects can be really severe, and some of the patients, especially who undergo transplant, get very higher doses of chemo, and this mucositis or inflammation in the mouth is very severe in those patients. When they eat anything spicy, it can give them a burning feeling in the mouth. Sometimes people lose their taste with the chemotherapy. So based on which chemo we are talking, one side effect may be predominant compared to the other one, but the mouth sores, inflammation, raw mouth, loss of taste are common side effects common to a lot of chemotherapies. Then comes our lungs. There are not many chemotherapies that can affect the lungs, but there are some in which we monitor the lung function test, because they can cause side effects like fibrosis of the lungs and interfere with the normal functioning of the lungs, which is to take in oxygen from the air and get that oxygen into our blood. But those are very selected chemos. The common example for that type of chemo is bleomycin. A common side effect which can come from any chemotherapy is infection of the lungs, but that is something that is common to a lot of chemotherapies, and just like any other infection, lung infections are also common when people are getting chemotherapies. Then below the lungs is our digestive system. And digestive system seems to be affected a lot by a lot of chemotherapeutic agents. Nausea, vomiting is a very common side effect. Almost every chemotherapy can cause that side effect. You need to have anti-nausea medicines at your home all the time if you are getting chemotherapy. Usually I prescribe this to all my patients on the very first visit when I'm planning to do chemotherapy. The trick is that you take these medicines at the first sign that you might be getting nausea, because you need to stay ahead of it. Usually the nauseous vomiting is most severe in the first few days after the chemo, and then it tends to slow down. Diarrhea is another common side effect. It's strange that some of the medicines can cause diarrhea, but some medicines can also cause constipation. A lot of chemotherapies can cause lowering of the blood counts. Chemotherapy are hard medicines which are hard on the bone marrow, and bone marrow is the place where all our blood cells are made. We have the white blood cells that fight infections. They are part of our immune system. When they get low, your risk of catching an infection becomes high, and that's how the chemotherapy affects your immune system. When the red blood cells get low, then people become anemic. They feel fatigue and tired and sometimes short of breath. And the third cell that our bone marrow produces is the platelet. If the platelet drop to an unsafe level, people are at increased risk of bleeding, because platelets are the cells which protect us from bleeding. And anytime they get low, the risk of bleeding gets high. Based on the dose, the schedule of the chemo, and the type of chemo, you can have pretty dramatic drop in all of these blood counts. Therefore, the risk of infections, the risk of developing anemia and bleeding can get high. Typically, the bone marrow recovers after a few days of getting chemotherapy. Usually between days 7 to 10, the bone marrow starts to recover. Then a lot of chemotherapies can cause hair loss. Some of the chemos don't cause it all, but some chemos are very notorious, and for certain chemotherapies it's about 100%. For some it's about 60 to 70%, but majority of the chemotherapies can cause hair loss, which again is temporary, and the hair tend to come back when the chemo is stopped. And it takes about 2 to 3 months for the hair to come back, but they almost do come back each time. Chemotherapy can also cause brittle nails, and they tend to crack, and they tend to break off easily. For that, we advise people nice moisturizing lotions and keeping their hands and feet moist all the time to mitigate that side effect. One of the very important short-term side effects of chemotherapy is development of dehydration, and that happens for several reasons. First of all, the cancer itself, takes your appetite away. You don't feel like eating and drinking much. And then when you add chemotherapy to that, that also has the same effect. So the dehydration can set in pretty quickly. When the dehydration sets in, people start to feel sick and tired and fatigued all the time. Therefore, keeping a good hydration is important, because dehydration is one of the very common side effects of chemotherapy. Then overall, people feel their energy level is very low, and that is actually coming from several different sources. But the energy level tend to get very low in a few days after getting the chemotherapy, and then it typically improves. So majority of the times before patients get their next cycle of chemo, they have recovered from the fatigue and loss of energy they had from the previous cycle. Then next, some of the chemotherapies can cause irritation of the nerves in the hands and feet. We call it neuropathy. A lot of times it is temporary and tend to improve in a few weeks' time, but sometimes it can be permanent as well. And not all the chemotherapies cause it, but some of the chemotherapies are very notorious to cause it. Now let's talk about the long-term side effects of the chemotherapy that can be permanent and may not improve even months to years after getting chemotherapy. As I was talking about the neuropathy, some of this neuropathy can be permanent, just like people who have diabetes have peripheral neuropathy in their hands and feet, and they have to take medications for that annoying numbness and sleepy feeling in their hands and feet. The same phenomena can happen with the chemotherapy. One of the long-term side effects of getting chemotherapy is development of other cancers down the road, and that may come decades after getting chemotherapy. Some of the childhood cancers, people when they are kids, they had cancer and they got chemotherapy. They were fortunate to get a cure, and now they are in their 40s, 50s, and 60s, develop a new cancer, which is actually a late effect of the chemotherapy they received decades ago. So therefore, development of secondary malignancies is a very well-known long-term side effect of getting chemotherapy. Sometimes chemotherapy can cause a permanent decline in the vital organ function like heart, liver, kidneys. These are our vital organs, and decline in the heart function can cause congestive heart failure. Decline in the liver can lead to liver cirrhosis, which is a permanent damage to the liver. And to the kidneys, it can cause chronic kidney disease. In the severe cases, that happens very rarely, but people can end up on hemodialysis. What's important is that you need to know the exact type of chemotherapies that you are getting and what are the side effects that those chemotherapies can cause. What I told you in this video was a general overview of the common side effects that are common to majority of the chemotherapies, but the side effect profile of the drug that you are getting might be different from what I just told you. Typically, every cancer patients before they start chemo have a chemo education class in which all of these questions are answered. Patients are also given written material for their own review, and you can also ask your doctors to elaborate these side effects for you. That's all I have today on the common side effects of the chemotherapy. If you have any questions, then you can leave a comment below. In this video, you can also visit my website www.onlineoncology.com, and I'll be happy to answer any questions that you may have.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.